Welcome back, everyone. October is Breast Cancer Awareness Month. It is the perfect time to encourage New Mexico women and men to get regular screenings. Breast cancer screenings can not only save your life, but they can also save money, as breast cancer treatment has the highest treatment cost of any cancer. Did not know that. That's pretty alarming. Joining us this morning, we have Dr. Carissa Geyer to give us more details about the signs, the symptoms, all the things we need to be doing and not doing, and then some. Good morning, doctor.
Good morning.
I'm super excited you're here. We had this conversation yesterday, but we are continuing today because we really want to get the message across here in New Mexico.
Yes.
So let's talk about why it's so important for us to talk about breast cancer.
Yes. So breast cancer in general, about 260,000 women and 2,400 men every year are diagnosed with breast cancer.
Wow.
Yeah, it's very high. In New Mexico, it's one of the highest, the diagnosis of breast cancer occurs most often in New Mexico, and out of all the cancers, it's the second leading cause of death.
That is alarming.
It is, it is.
And to hear those numbers, because typically I think the general population, we feel like breast cancer, we can treat it, we're going to survive. But when you hear the numbers of how high it can be when it leads to death, that is pretty scary.
Yes, and this is why it's very important to get your screening done early and often.
That's what I was going to ask you next. Why is it that it's so high? Is it because people are not getting screened enough or early enough?
That's a great question. I think there are a lot of variables involved with that. And again, I can't really give a specific answer to that. But we can catch it early, and if we catch it early, then most individuals have a longer opportunity to live a longer life and have decreased healthcare costs because of the diagnosis of cancer.
All right, tell me the age that women and men should be getting screened for breast cancer.
So this is a very good topic, and it changes depending on the organization that you're looking at. The United States Preventive Task Force, USPTF, they recommend between the ages of 50 and 74, you are screened every 2 years. And if you're between the ages of 40 and 49, you have the opportunity to go in and get screened every year. If you look at the recommendations from the American Cancer Society, they believe everyone has the opportunity to be screened every year from the ages of 40 and 44. But when you hit the age of 45 to 54, they want you to be screened every single year.
They want.
Yes.
And that's the difference here.
Correct.
You can versus they want.
Correct.
And you should heed the warnings.
Yes. And then at the age of 55, that's when we switch to every 2 years. And when we stop screening, that will be based on a discussion that you have with your healthcare provider.
Okay.
Overall, the big thing that we need to remember is that if you want to get screened at 40, 50, doesn't matter, you need to have that conversation early with your healthcare provider.
What if you find a healthcare provider that is just saying, you're okay, you don't need to go get screened? Do you come across that often?
No, I do not come across that often.
Okay, good.
But if you do, you can always go to someone else and have this discussion to see if you are appropriate for screening.
Okay. I want to talk real fast, about 30 seconds on this topic, about self-examination, because that's been a hot topic since I was young.
Yes.
Are we still doing this?
Yes, and so it depends on which provider you talk to. Some say yes, some say no. I think it depends on the individual and if they feel comfortable, or you know what, if they have history, family history, definitely want to do some self-screening at home. I think it's great for everyone to do it because that individual will have an idea of what their body type is, and any abnormality that they come across, they can immediately go and talk to their healthcare professional about it.
All right, so get screened.
Yes.
Get screened often,
Yes.
especially when you're in that age bracket.
Yeah.
And yeah, talk to your provider, especially if you have any questions, right? If you
Yes.
feel something is wrong, you might know something is wrong with your body. You know your body the best. Doctor, give me a website we can find more details.
Oh, you can definitely go to one of our Optum websites and the CDC as well. We also have a community center opening up November 7th. That's at 4010 Montgomery Boulevard Northeast, and it's east of Carlisle, west of Jefferson. Come see us, and we can definitely talk to you more about screening and get you to the right person to get it done.
I like it. All right, you want to recap of this? Go to our website. That's always on KRQE.com. Let's keep this conversation going, ladies and men.